Week is officially here. From April 11th to the 17th, join the Black Mamas Matter Alliance and our partners and collaborators nationwide for a week of events and activities to build awareness, activism, and community around improving maternal health outcomes for Black women and birthing people. Launched in 2018, Black Maternal Health Week was founded by BMMA to deepen the conversation about Black maternal health in the U.S. and across the diaspora, amplify community-driven policy, research, and care solutions, center the voices of Black mamas and families, and more. From in-person events like our annual Black Maternal Health Walk to virtual panels and other activities, Black Maternal Health Week enhances community organizing, centers Black feminist and womanist wellness approaches, and provides a platform for Black-led entities doing maternal, birth, and reproductive justice work as part of the global fight to end maternal mortality. Check out what we have in store for you this year. We look forward to seeing you out there. Be sure to follow BMMA across social media and join the national conversation online using the official hashtag BMHW.
Hello, everyone, and welcome to the Black Mamas Matter in Policy and Practice virtual rally. We are so excited to have you all with us in honor of Black Maternal Health Week. I am Angela Doinsala-Aina, co-founder and executive director of the Black Mamas Matter Alliance, and I am joined by our federal policy manager, Clark Wheeler.
Hey, everyone.
Hey, Clark. And also, I am joined by Stephanie Aristide, our Policy and Advocacy Associate.
Hi, everyone.
Hey, Stephanie. We are with the Black Mamas Matter Alliance, which is a national network of Black women-led organizations and multidisciplinary professionals whose work is deeply rooted in reproductive justice, birth justice, and the human rights framework in order to ensure that all Black mamas have the rights, respect, and resources to thrive before, during, and after pregnancy. We are excited to continue the celebration of the 6th annual Black Maternal Health Week campaign, which is founded and led by BMMA to deepen the national conversation about Black maternal health so that public stakeholders understand how root causes like systemic racism acts as drivers of maternal health inequities. Now, I'll pass it on to our co-host, Clark Wheeler.
Thank you, Angela. Before we get started, we would like to cover some logistical items. For your awareness, this virtual rally is being recorded and live streamed on YouTube, on BMMA's YouTube channel. Everyone is currently muted and will stay muted during the rally. Along with this event, we invite you to engage in the social conversations on Black Maternal Health Week using the hashtag BMHW23 and visit blackmamasmatter.org to find events happening across the country. And now I'll pass it over to Stephanie.
Thanks, Clark. Before we begin, we have a question for some of our audience. For our attendees on Zoom, you will see a polling question pop up on your screen. We want to know what Black maternal health issue is most important to you. For our YouTube audience, you may write your answer in the chat box. Some of the options are research and data, criminalization of Black birthing people and families, Black maternal and perinatal workforce development, structural and social determinants, full spectrum maternal, sexual, and reproductive health care, or Black women and birthing people's leadership of Black maternal health. Please submit your answers while you can. While you're doing that, I want to remind you we have some incredible speakers joining us today, like Representatives Alma Adams, Lauren Underwood, and Park Cannon. You will also hear from our diverse range of alliance partners like Dr. Monica McLemore, kwajalin Jackson, Dr. Karen Scott, Jenny Joseph, and so many more. I can't wait to hear from everyone. Now back to you, Angela.
Awesome. After many years working with our alliance in identifying key Black maternal health issues and building consensus on recommendations, we are excited to officially launch BMMA's policy agenda, which outlines our policy vision for the Black maternal health, rights, and justice movement. We believe we can only advance this vision through collaboration across sectors, disciplines, and geographies. And that's why we are so delighted to have you all here today and to hear from some incredible speakers who are doing this work across the country. The first section of our policy agenda is structural and social determinants of Black maternal health. We are calling on policymakers to identify, eradicate, and provide restitution for systemic and structural harms against Black women and birthing people in areas of housing, environmental justice, food sovereignty, human rights, and more. We also call on policymakers to invest in Black-led and centered community-based organizations and center Black women and birthing people as they develop and implement systems and structures. Now, let's give it up for our speakers. Jessica Roach, CEO of Restoring Our Own Through Transformation, Roots, and BMMA's board co-chair, and Congresswoman Alma Adams of North Carolina. Jessica?
Thank you so much, Angela, and it's wonderful to see everyone today. We're excited to have you here for the launch of our policy agenda for Black Mamas Matter Alliance. And one of the primary topics of this policy agenda is to be really clear about addressing what are not just the social determinants of health, but what are the structures that have actually created what are the unmet social determinants of health. This is a major issue for most of us within the Alliance. It is something that impacts those community-based organizations. And so for us, it is about making sure that we're not only identifying what those systemic and structural harms are, but we are working towards eradicating them, as well as providing a restitution so that we can rebuild and be able to sustain and support Black-led community-based organizations that are on the ground doing the work. It also means in that, what does that actually mean? It means to make sure that we're not just addressing what is a lack of affordable housing. It is making sure that we have absolute access to housing that is safe and sustainable, and also working towards dismantling some of those structures that have kept us from being able to work towards being able to have home ownership, which will ground us in generational wealth. It is also important for us to be sure that we are addressing this from an environmental justice perspective and being clear about how our neighborhoods are disproportionately impacted consistently through pollution, through development, through gentrification processes, through being moved, and not being able to have that level of sustainable environments for our families to be able to thrive. It is making sure that our health education and the re-empowerment of our people actually encompasses and engages those that are within the healthcare profession and the medical profession so that we can address those medical misnomers that often impact us inappropriately, because we know that it is not about Black race as our health risk factor. It is about the firmly entrenched racism, systemic and institutional, that is communicated throughout obstetrics and gynecology that negatively impact what our outcomes are. We need to also be very clear when we're talking about this, that we're talking about the relationship between those entities, those of us that are the community-based and community-led entities, being able to have the access to truly sustainable grants and investments. So that's not looking at it from a year perspective or a 2-year perspective. That's looking at it from the long-term perspective of being able to invest in programs that have proven that they work and that they address the issues within our families throughout this country. We also need to be very, very clear that we are centering the voices of Black families and Black women as we're moving through and to develop and implement equitable structures, equitable, not just the equal, but the equitable structures that are necessary so that we can have our own ownership in our care as we move forward and how the systems of care are actually developed, because we have significant resources within our communities to be able to address the issues at hand when it comes to Black maternal and infant health. And with that, I would like to hand it off to Representative Alma Adams. And I appreciate your time, and we look forward to hearing from everyone today.
Thank you, Jessica. Good afternoon. I'm Congresswoman Alma Adams, and I am a proud Black mama and grandmama. And I'm honored to speak with you today. The work of Black Mamas Matter Alliance and Black maternal health advocates saves lives. And your work not only saves lives, but it improves outcomes and the quality of care for all parents from every background. And so as the co-founder and co-chair of the Black Maternal Health Caucus, as well as the lead sponsor of the Black Maternal Health Momnibus and the Kira Johnson Act, I spend a lot of time working on social determinants of health. Because like Fannie Lou, I'm sick and tired of being sick and tired of the inequality. The inequality that Dr. King talked about when he said of all of the forms of inequality, injustice in health is the most shocking and the most inhumane, because it often results in physical death. And unfortunately, that's still true. There are major gaps in care based on socioeconomic status and race and other factors. And it's true we've made progress, because before the Affordable Care Act, women were paying significantly more for health care and health insurance than men. Medicaid expansion, which is finally coming to my home state of North Carolina, closes many of the gaps in care that are exacerbated by social determinants. And unfortunately, maternal mortality and morbidity rates in the US continue to go in the wrong direction, and the outcomes gaps between Black and white parents remains. Now, demographics should not determine your destiny, but we got to be real today, it does. And so it's going to take addressing social determinants of health, from poverty to education, to transportation and environmental factors, to save lives. And that's one of the things that we accomplish in the Black Maternal Health Momnibus Act, which I am proud to announce that we'll be introducing with my colleague Lauren Underwood in the 118th Congress. It's a bill without a partisan agenda, because Black maternal health is not a partisan issue. It's a life and death issue, because Black mamas' lives matter. And that's why we are very intentional. And we were very intentional when crafting this legislation about centering the voices of Black women and ensuring that Black women-led organizations were consulted early and consulted often, including BMMA. This legislation unequivocally says that Black mamas matter. And so the Momnibus comprehensively addresses every aspect of the Black maternal health crisis. My bill, the Kira Johnson Act, makes investments in community-based organizations that are leading the charge to protect moms by supporting doulas and perinatal health workers and addressing social determinants of health, like housing, transportation, and nutrition. It also supports research, bias and racism training programs, and the establishment of respectful maternity care compliance offices to address bias and racism. And at its core, addressing social determinants of Black maternal health is really all about accountability. It's about empowering our community health partners who have been providing safe and culturally sensitive care to Black moms for years. And so it's really all about power. And power is what makes the difference in lives and communities. And over the past 3 years, if we haven't learned anything else from this pandemic, it has shown us how precious, how fragile, and how fleeting life can be. But it should also tell us how quickly we must act. So I'm delighted that we have gathered today to celebrate but also to educate. So please, after this event, continue to be advocates for Black moms and the momnibus, because Black mamas can't wait. And like Fannie Lou, we're sick and tired of being sick and tired, and we will not wait. Thank you. God bless.
Thank you so much to our speakers, Jessica Roach and Congresswoman Adams. The next section of the policy agenda is full spectrum maternal, sexual, and reproductive health care. We are calling on policymakers to make BMMA's holistic care principles a reality through comprehensive insurance coverage, expanding equitable, high-quality, patient-centered care across geographies, and funding research and programs that center Black women and birthing people. Let's give it up for our speakers, Congresswoman Lauren Underwood of Illinois, and Kwajalin Jackson, Executive Director of Feminist Women's Health Center and BMMA board member.
Hi, everybody, and happy Black Maternal Health Week. I'm Lauren Underwood, and I have the honor of representing Illinois' 14th Congressional District. As a co-founder and co-chair of the Black Maternal Health Caucus, I am delighted to be joining the Black Mamas Matter Alliance for today's timely conversation about the importance of advancing Black maternal health through policy change. I'd like to begin by thanking Angela Ina and the entire Black Mamas Matter Alliance team for your visionary leadership to establish Black Maternal Health Week and for everything you do on behalf of Black moms across the United States. Your work couldn't be more impactful, especially in light of the Dobbs decision and other court cases that make it more urgent than ever that we advance legislation to expand access to full spectrum maternal, sexual, and reproductive health care. I've been so proud to work with the Black Mamas Matter Alliance to develop, introduce, and advance the Black Maternal Health Momnibus Act, a sweeping package of 12 bills that build on existing legislation to comprehensively address every driver of maternal mortality, morbidity, and disparities in our country. Thanks to your partnership, we've seen tremendous progress on moving this legislation forward, including the first bill in the Momnibus getting signed into law and many other key priorities receiving the highest levels of federal funding ever. But we know there's so much more work we need to do, starting with passing the entire Momnibus, and I look forward to working with you to do just that. And we won't stop there. We must ensure everyone has access to all of the sexual and reproductive health care services they need and deserve, including abortion care. Simply put, abortion is health care, and I will never stop working to protect the freedom of all women to make their own healthcare decisions. I'm thankful for your partnership on these shared priorities. I can't wait to see you again in person soon, but until then, I wish you all the best for Black Maternal Health Week and all the important work ahead of us in 2023 and beyond. Take good care of yourselves.
Good afternoon. I'm Kwajalin Jackson, the Executive Director of Feminist Women's Health Center in Atlanta, Georgia. As a Black woman, I deeply believe that reproductive justice is critical to our collective liberation and must be centered and tangible in everything that we do. Our work stands on the legacy of the incredible Black women who developed the reproductive justice framework to speak to the lived experiences of women of color who didn't believe that the privacy-based pro-choice movement fully captured our challenges or our opportunities to achieve self-determination for ourselves and our communities. Feminist Women's Health Center is a Black-led, independent, nonprofit, multi-generational, multiracial reproductive health, rights, and justice organization that is committed to a vision of accessible and judgment-free reproductive health care and abortion access in the South for all who need it. We provide direct services, education, advocacy, leadership development, movement building with people across all axes of oppression so that we have the rights, resources, and respect to make empowered and informed decisions about our own bodies and our own health. In spite of the ways that this country has tried to extinguish abortion access across the country, We still provide both medication and procedural abortion care, just as we have since 1976. In the midst of an unprecedented reproductive health care crisis, we are anchored by our commitment to reproductive justice. It's clear that the legal right to abortion cannot be the only centerpiece to our work. Abortion is under constant and increasing threat, and though we will never abandon abortion care, we know it is not the only thing that our communities need to thrive. We envision a world where all of our decisions about our bodies, pregnancy, sexuality, family, and safety are honored, protected, and treated with dignity, because reproductive justice is reflected and experienced in everything that we do. To realize this vision, we need the agility and the tenacity and the stability to meet community needs, evolve and adapt to the ways the world is changing around us, and to develop the next generation of leaders so that we can withstand the political instability of abortion laws and more holistically serve our community. As a part of our strategy for survival and our trajectory towards liberation, Feminist Center intends to move more deeply into our values, expanding our gender-affirming care, providing better support for fertility, pregnancy, birth, postpartum, and parenting, in addition to providing compassionate abortion care that we always have. This is not just about adding new services, but it is a strategy to operationalize the Black Mamas Matter Alliance holistic care principles into practice. We intend to make reproductive justice tangible and felt by the communities that we serve, to help people actually experience reproductive justice in their clinical care, as well as in the community, and sustain our work into the future. We hope that this can be one model for the future of independent community clinics, bringing us closer to that liberated future. We believe that by creating more holistic and comprehensive reproductive health care that centers Black and Indigenous people of color, queer and trans people of color, and that is rooted in Black feminisms and reproductive justice, more people who have been historically and traditionally neglected or harmed by healthcare institutions will have access to wellness and wholeness over a lifetime. We believe that when we center the most effective, all others benefit. We believe that trans people should have a safe place to access safe reproductive health care. We believe all people with the capacity to become pregnant should have access to affordable, compassionate, judgment-free health care that includes abortion. But we also believe that empowered decision-making is not enough to overcome the systemic oppression that our communities face. And so we must also fight for system change at the municipal, county, state, and federal levels to truly disrupt the harmful and violent systems of oppression that persist. We believe in Black leadership, Black wisdom, Black expertise, Black joy, and Black imagination to create new ways of doing and being with one another. Our hope is that we can use our clinic as a space where reproductive justice can truly thrive, and to demonstrate how longstanding institutions can transform and reckon with their founding to evolve while honoring an existing legacy. I'm grateful to know that Feminist Center is not alone in this fight. We exist as a slice of an incredible body of work that is being done, and we're proud to be a part of the powerful legacy that all the members of the Black Mamas Matter Alliance are working together to continue. Thank you.
Thank you so much to Congresswoman Underwood and Kwajalin Jackson. The next section of the agenda is Black maternal, reproductive, and perinatal workforce development. At BMMA, our primary stakeholders are the Black maternal, perinatal, and reproductive health workforce. Therefore, we are calling on policymakers to expand licensure and scope of practice, increase reimbursement rates, and improve recruitment, education, and retention strategies for Black midwives, doulas, lactation support providers, and other professionals. This also includes funding for Black-led and centered community-based organizations, birth centers, and maternal, mental, and behavioral health care programs. Let's give it up for our speakers, Jenny Joseph of Common Sense Childbirth in Florida, Astir Bay of Village Birth International in New York, and Congresswoman Gwen Bohr of Wisconsin.
Thank you so much. And it's such a pleasure and an honor to be here with everyone today. Happy Black Maternal Health Week 2023. My name is Jenny Joseph and I'm a midwife. I am celebrating my 42nd year as being a midwife. I was born, raised, and trained in the United Kingdom, but I've been in the States since 1989. My organization, Common Sense Childbirth, is celebrating its 25th year this year as a nonprofit organization in Central Florida. And the work that we've done at Common Sense Childbirth opened my eyes to solutions for these supposedly intractable problems that we have experienced in the United States, particularly when it comes to poor birth outcomes for Black women and birthing people. I'm so proud and thankful that I can stand on the shoulders of America's Black midwives through enslavement and on through Jim Crow, and continually Black midwives have served, Black midwives have delivered America. And as midwifery has its new version of a resurgence, I am thankful that we are able to lead from that place. We have in Central Florida established midwifery practices. We have a birthing center. We provide easy access clinics where we make sure no one is turned away. Anybody who needs access to care gets that access. And what we have seen is that when we provide this unrestricted, respectful care where dignity is maintained, where the families and mothers, parents are centered, their outcomes are improved vastly. We don't see premature babies in our practice. We don't see low birth weight babies. Our mothers are not suffering from preeclampsia, high blood pressure, or having unnecessary cesarean sections. Our mothers, our families, our babies live. Our program has been built on 4 tenets: access, connections, knowledge, and empowerment. What we are looking for is perinatal well-being, perinatal transformation. We need perinatal power, access to policies that support our growth so we can grow this perinatal workforce that is desperately needed, this community-based workforce that is on the ground and is able to follow on from the work that has been done for decades in improving access to safe quality care. We need access to licensure. We need scope of practice. We need states where we are not able to be reimbursed for our work to change so that we can bill for our care just like any other provider. The doulas, the lactation educators, the reproductive health workers, the birth workers on the ground are getting things done. And we know that we can support them as we train them. We help them get credentialed and we put them out to work inside of this perinatal ecosystem that is so necessary for the change in these outcomes. We also know that we need collaboration. We need support from other institutions, organizations, and funders. The money needs to flow to the people who are doing the work so that we can prevail. The knowledge that we've gained as we do this work as we go along is that this is a structural problem. This is a systemic problem. It is racism, classism, sexism that is harming and killing our communities. It is not a physiological issue. A cervix will lock tight and hold a baby all the way to term when a mother, birthing person is taken care of safely, with quality care, with respect and dignity. The empowerment that comes from that way of being is what will make the difference in this fight. And we are grateful at Common Sense Childbirth to be leading in terms of building out national networks of people who are like-minded and making sure that we fight for the policies that we need to make this change sustain. So thank you.
Good afternoon. My name is Astir Bay, and I'm the co-director of Village Birth International and the co-founder of the Sankofa Reproductive Health and Healing Center, where I'm currently a director of community education and policy. I'm so excited and honored to be here today, uplifting the work of my fellow Alliance members and the work of our community-based doulas and birth workers in Syracuse, New York. At Sankofa, we have created a perinatal workforce of doulas, public health educators, lactation counselors, and liberators out here for reproductive justice. Our perinatal safe spot, guided by our mentor, Jenny Joseph, is a part of a larger community-led movement across the Alliance for Black Maternal Health Leaders to uplift their own perinatal workforce. As stated in our policy agenda, Black perinatal and reproductive health workers are uniquely positioned to provide holistic, culturally congruent care to Black women and birthing people. Legislation that fails to center this life-affirming work is absolutely and fundamentally counterproductive to advancing Black maternal health rights and justice. We must have policy and implementation methods at the local, state, and federal level to reflect the services and care we provide every day to our community. For Black maternal health policy to actually work, we need Black community care providers at the table to discuss, arrange, implement, and evaluate. To sustain our work, we must create equitable payment and reimbursement structures that support existing Black community-led, community-based birth work and doula organizations. Payment systems must reflect that organic and holistic way we provide services and the multiple entry points that families access care at the community level. We must fund organizations to support a workforce by eliminating administrative burdens, including payment delays and unnecessary surveillance. Training models and evaluation methods of existing community-based organizations must be uplifted and implemented in all policy initiatives. Black-led organizations across the Alliance have spent years training and mentoring perinatal health professionals, including community-based doulas. Our standards of care ensure doulas are supported and families receive the quality of care they deserve. We have an opportunity to do better this time. Policy for successful Black maternal health reform demands systemic changes in healthcare and also funding, supporting, and advancing a community-led perinatal workforce. I'm honored to be on this call with these great leaders, and we all look forward to the reproductive justice that is to come.
Hi, my name is Gwen Bohr, and I am so proud to represent the 4th Congressional District of Milwaukee, Wisconsin, which is centered in Milwaukee, Wisconsin. I am so happy to be here participating in this Black maternal reproductive panel, but even more importantly, I am happy that Black Mamas Matter even exists. I am so happy that we're having a conversation about Black women's reproduction in some context other than over-sexualized way or with welfare queens, but to really address a problem, the high maternal mortality that has fomented among our population to the point of being an international disgrace. So thank you for continuing to put this issue and center it around care for women. You know, I've got a lot of skin in the game. God willing, I'll be 72 years old on the 18th of April. But I am a mother, a grandmother, and a great-grandmother, Gwen. So they just call me G because I'm a triple G, great-grandmother Gwen. I am the head of a queendom, and I have a daughter, 3 daughters, 2 great-granddaughters, and a 3rd great-granddaughter due in June. Let me just tell you that my passion for this issue comes from my lived experience. You know, I gave birth at age 18 in an environment that was so traumatic for me that the next 2 births I had, my 2 sons, I had them with midwives at home. I felt that I needed for my mental and physical safety. My only daughter, gave birth and had 3 cesarean sections and yet was able. I was kind of her doula. You know, I'm the queen in my queendom, and maternal health is very personal to me. But not only is it personal to me, it is a lifeline in terms of addressing, combating almost genocidal problems in my state, in my district, and in the state of Wisconsin. Black mothers are 5 times more likely to die in pregnancy than white women. That is catastrophic, and it just breaks all kind of international boundaries. One way that we can combat the maternal health crisis is by expanding and diversifying the perinatal workforce. As you have already seen from the doulas and midwives who've spoken before me, perinatal community-based models of care are great. They offer enhanced care and support through pre-pregnancy and the postpartum spectrum. And this includes doulas and midwives and services to pregnant women who face barriers. My barrier was that I was only 18 years old. And this is why I'm such a huge advocate and so grateful for the co-chairs of the Black Maternal Health Caucus, Representative Lauren Underwood and Reverend Dr. Alma Adams, who put together this package of bills that includes my legislation, the Perinatal Workforce Act. You know, more than 1/3 of U.S. counties are maternity care deserts with no hospitals offering obstetric care and 0 obstetric providers. And it's a challenge in both rural and urban America. Specifically, my bill, the Perinatal Workforce Act, would address this lack of access to care by increasing the pipeline of culturally competent maternal care professionals. It would provide guidance to states on the promotion of racially, ethnically, and professionally diverse maternity care teams, and would study how culturally congruent maternity care promotes better outcomes for moms, especially in communities of color. This legislation would establish grant programs to increase the number of maternity care providers and non-clinical perinatal health workers who offer support to women during their pregnancy and after. This is one of the ways we can address the systemic challenges in our healthcare system and connect Black mothers to the perinatal professionals that they need. Just want to comment on the need to actually provide funding for doulas and midwives. Health and Human Services under Joe Biden has said that they want to do that. And so I have another initiative, Mamas First, that would ask for doulas and midwives to be funded through Medicaid. So I want to thank you all for the opportunity to speak today. I'm fired up, ready to really dig into reducing the maternal mortality, and hopefully one of these days we'll just be having cocktails when we meet, because this will no longer be a problem. And so I would now yield the floor.
Thank you so much, Congresswoman Gwen Bohr. We love hearing about all the work that Jenny Joseph and Astir Bay is doing. Our next section is criminalization of Black women, birthing people, and families. We are calling on policymakers to decarcerate, decriminalize, and defund surveillance and punishment institutions and systems. We are calling for protection of Black women, birthing people, and families involved in the criminal legal system, and new pathways for Black women and birthing people's freedom and liberation. We will now hear from Erin Miles Cloud of Movement for Family Power, Chantel Norris of Baobab Birth Collective in Alabama, and Senator Cory Booker of New Jersey.
Thank you, everyone. My name is Erin Miles Cloud. I use she, her pronouns. I'm calling in from Lenape Land, the Bronx, and I really appreciate you all having me today. As mentioned, I am the co-director and co-founder of Movement for Family Power. We're a small organization that envisions a world where families can live safely together and Black birthing people are no longer criminalized for raising their families. I'm also the proud mother of 2 Black kids that I fight for every day, and I fight for the future of all Black children. We're excited to participate today in Black Maternal Health Week and are always thrilled to be in our community with Black Mamas Matters. We believe that Black and brown mothers, including poor mothers, including mothers who use drugs, including mothers who are fighting different systems, all love and care for their children and want to do what's best for them. We believe in Black families. We believe that we are safety. We believe that we must protect all Black women, birthing people, and families involved in criminal legal systems, juvenile systems, adult prisons, and jails, the family regulation system, immigration, and detention centers. So we seek maternal health policies that change the conditions for birthing and parenting people to fight to dismantle the architecture of criminalization in the United States through decarceration, decriminalization, and defunding surveillance and punishment institutions. We demand and we mean that our policy agendas have to include ending forced family separations, repealing the Adoptions and Safe Families Act, dismantling CAPTA, ending mandated reporting as the sole response to child safety, and ending incarceration as a response to social issues, especially for pregnant and parenting people. But we know that is just the beginning. There are no policies, and honestly, there is no safety without investing in Black-led and community-based transformative justice, Black-led anti-violence programs, and strategies led by Black mamas, Black parenting people that truly address the conditions that they are living in, the conditions of our communities, and the social determinants of health. It is with this investment that we will build health for everyone while making sustainable pathways for all Black birthing people. And we can, and we believe we will build a world centered around Black families and a world that cares for Black mamas. Thank you so much, and thank you so much, BMMA, for having us today.
Good afternoon. My name is Chantel Norris, and I'm the co-founder of Bay About Birth Collective, and I'm the co-director of the Alabama Prison Birth Project. I echo everything that Erin said. In this country, over the past 30 years, incarceration of women and girls has increased by 700%, and it's continuing to rise. This includes the federal and state prisons, city and county jails, as well as juvenile and immigrant detention centers. But why is this happening? Have women somehow become more violent or more dangerous? Absolutely not. What's happening is that in our communities, there's hyper surveillance. That includes police, we're talking about CPS, mandatory reporting by doctors' offices. And unfortunately, recently in the past week, we've seen what that looks like in action. The Jackson family in Dallas, Texas, a medical provider reported them based on his biased opinion and observations. And CPS was called, and a newborn infant was removed from her loving parents and family. That is a problem, and that is something that we cannot stand for. I wish this was an outlier. I wish this was a really unique case that was just unfortunate. However, it's not. I can't tell you how many times I've heard similar stories from the birthing people that I serve. And oftentimes this leads to their unjust incarceration. Of women and girls that are incarcerated every year, about 55,000 of them are pregnant. Think about the impacts of that on those mothers and those unborn children. Usually when a mom is incarcerated, she doesn't get access to healthy food. She doesn't receive good health care. And believe it or not, there's no oversight for these facilities. So they get to handle pregnant women at their discretion, however they choose. What can we do about this? Well, most pregnant incarcerated women are there for crimes of poverty. They're there for crimes related to substance use and mental illness. So what if instead of incarcerating people, we gave them the resources and tools that they need to be whole? What if we took some of that funding that we spend on incarceration and redirected towards social support? What if we gave funding to community organizations who are already doing the work? The answers already lie within our community. What if we were well funded? Until we start eliminating the practice of incarcerating pregnant women and girls, we will be here at the Alabama Prison Birth Project supporting these women. We're going to keep giving them doula support, bringing in healthy meals, and transporting their milk to their babies. The answers are already within our community because we are the ones that we've been waiting for. Thank you.
Hey, this is Cory Booker. I'm seeing that I can't get my camera. I cannot start my video because the host has disabled it. But I will. There we go. I just want to, first of all, say hallelujah, amen. The remarks that were just made speak to my heart. And I want to just speak directly to the realities we have in America right now, where we are over-criminalizing women. 1 out of every 3 women incarcerated on the planet Earth is in the United States of America. And for those people who spend time and listen to the voices of these women, I remember sitting in a federal penitentiary and just sitting with women. Before I went in, I asked the warden, how many women here are survivors of sexual trauma and violence? And she said over 90%. When I sat with these women and heard their stories, so many of them clearly needed trauma-informed care, support with addiction, which is a disease, support with the challenges they were facing with mental illness and more. We live in a nation where we not only over-criminalize women, but we do things that other communities consider torture, solitary confinement, shackling pregnant women. We deal with conditions like poverty by not just creating difficult traps from which women to escape, traps that people plunge into are more likely to when they have children because of the costs that we as a society have not stepped up to help bear. But we are also a nation that has created a reality where often people who are in poverty begin to get warrants out for their arrests because we still have a system that punishes poverty often with jail. All of these things and more have created a society that is not just doing things that are morally wrong, but actually contribute to the problems that we deplore. And on top of that, we are doing it in a way that has costs, not only economically that are far more expensive than investing in compassionate care, but we also take an uncalculable toll, a cost upon the children of these extraordinary American citizens. And so we can choose a different way. We are fighting a tough battle right now, where we see from the Supreme Court to state legislatures criminalizing a woman who takes reproductive care into their own hands. We are facing challenges now where we continue to be in a system where people think that the solutions to so-called problems or to the challenges we face with crime are stiffer penalties and not providing an understanding that to create safer communities, stronger communities, more whole communities means having an eye towards mental health care and healthcare, an eye towards helping with addiction, with healthcare in general, with making sure that we are providing nurturing environments for our kids. On the Senate level, I am fighting this battle in a Senate that has no Black women, and in the history of our country has had only 2. I'm honored to be able to partner with congresswomen like you had earlier on to try to focus on maternal mortality and Black maternal mortality. I'm honored to be in a fight now to continue to make progress in changing our criminal justice system into one that puts justice at the center and doesn't create realities like Brian Stevenson talks about, where we have a nation that treats you better if you're rich and guilty than if you're poor and innocent. I will continue to champion the things that work to support birthing people, that work to support children, that work to lower crime, actually, that work to elevate human flourishing, as opposed to reactive measures that often more are about vengeance or pursue tactics that result in wild racial disparities and ultimately make us all poorer and more at risk. I want to thank the speakers. I want to thank this group that's pulling folks together to focus on truly elevating human potential and finding solutions that work, not doubling down on the mistakes of our past, but finding breakthrough means with which to be a nation who we claim we are, a nation with liberty and justice for all. And the power of understanding what justice is justice can't be just for some people. It has to be for all people, because injustice anywhere is indeed a threat to justice everywhere. Thank you.
Thank you so much to our incredible speakers for the powerful remarks. Thank you, Erin Miles Cloud, Chantel Norris, and Senator Cory Booker. The next section of the agenda is research and data transformation. We are calling for policymakers to apply BMMA's research principles to all research activities with, for, and by Black mamas. This includes maternal mortality review committees, clinical trials and experimentation, community-based research initiatives, and more. Now we will hear from Dr. Monica McLemore of the University of Washington and BMMA board chair, and Dr. Karen A. Scott of Birthing Cultural Rigor. Dr. McLemore.
Good morning, everyone. I am thrilled to be here, and happy Black Maternal Health Awareness Week. I'm here both in my capacity as a proud Black Mamas Matter Alliance board member, as well as a researcher and an academic. I have to say it's both a privilege and an honor to be here, and I'm really excited to share some thoughts with you. When I reflect on the state of our current scientific enterprise, I can say without hesitation that we need to stop describing problems, and we need to design and test interventions. We need to invest in assets and strengths. We need to more broadly understand how to fund community-based organizations and people with lived experience who are already doing this incredible work at far beyond a living wage. And we need debt-free education for any Black person who seeks to advance their education in the health professions and the social sciences. Right now, because I know there are a lot of people on this call, I'm going to speak to legacy funders and legacy funded organizations. Stop hoarding resources to complete the same dated work. We need new research variables and categories to replace everything from early entry to prenatal care, because that means nothing in the era of Dobbs. We need to stop using body mass index, pulse oximetry, and other algorithmic shortcuts grounded in anti-Blackness, anti-fatness, and that reinforces whiteness as a default standard of humans. And finally, let me end with my passion that we heard so eloquently 2 panels ago on workforce development and research and dismantling healthcare hierarchy in the research enterprise. Our research is only as good as the teams who design and develop the questions, the methods, and the analytic rubrics. Our evidence base will remain incomplete if we do not invest in experts by experience as well as experts by education. We need to do both to do this important work. And I need all of us to stop talking about doing this work and start doing this work. So with that, let's hear from Dr. Karen Scott, who is doing both.
Greetings and thank you for birthing cultural rigor. We must boldly reconcile with 7 limitations that shape and ground community-led accountability and transformation in research and data sovereignty. 1, ethics. Fund, support, and amplify Black women, Black people-led community initiatives that unapologetically and radically activate the power, potential, passion, and promise, not pathology of Black lives and livelihoods. 2, knowledge. Operationalize Black women's people's theories and naming, defining, examining the challenges and offering solutions. Demand historical contextualization and contemporary implications of different types and levels of oppression, such as a medical misogynoir and obstetric racism, as well as different types and levels of individual and collective resilience and resistance. 3, leadership. Examine leadership's proximity to the outcomes of interest and to the communities most impacted, and how proximity, positionality, and power impact the 4 T's: truth, trust, transparency, and transformation. 4, science. Prioritize methods of data collection, analysis, and interpretation of both narratives and numbers that illuminate the nuances, diversity, beauty, complexity, and power of Black women's and Black people's humanity, ingenuity, and innovation. 5, measurement, selection, and monitoring strategies. Implement measurement, monitoring, and mitigation strategies that best uncover the problems and create solutions as defined for, by, and with Black patient, community, and content experts. Outcome-only measures evaluate the physical performance of the Black birthing body in response to the quality of care, as well as generations and centuries of violence, control, injustice, and dominance. Thus, the over-reliance and misuse of clinical outcomes-only measures as performance indicators create a false narrative of quality and safety, and fail to capture hospital performances based on how well or how poorly hospitals see, hear, believe, support, want, and celebrate Black people. 6, data quality and accessibility. Consider data sources and types, and how data is collected, stored, analyzed, interpreted, utilized, triangulated, and shared. Ask yourself, how does your data infrastructure reinforce power inequities and oppression? And how does it redistribute power and advance liberation and sovereignty? 7, community participation and partnership. Acknowledge, activate, affirm, and amplify community participation and partnership with equitable compensation and resources without structural and institutional barriers such as work first and pay later or never reimbursement practices. We must continuously re-examine these 7 pain points as performance indicators for implementation, spread, and scale of Black women and people first and focused community-led accountability and transformation in research and data sovereignty. Thank you so much.
Thank you so much, Dr. Monica McLemore and Dr. Karen Scott. We know how important research is. The final section of the policy agenda is Black women and birthing people's leadership. We are calling on policymakers to invest in Black-led and centered community-based organizations, remove barriers to these organizations receiving funding and support, and to honor Black women and birthing people's culture, histories, and traditions. Now we'll hear from Chantel Bennett Reed of Mothering Justice and Georgia State Representative Park Cannon.
Hello, everyone. I'm so excited to be here. My name is Chantel Bennett, and I am the Black Maternal Health and Reproductive Justice Organizer at Mothering Justice here in Detroit, Michigan. Mother and Justice is a grassroots policy and advocacy organization that provides mothers of color in America with the resources and tools to use their power to make equitable changes in policy. And we're dedicated to improving the quality of life for families in America by empowering mothers of color to take action on American policy on behalf of themselves and their families. The experiences of mothers of color must be at the center of policy, organizing, and communication. We must center the voices in order to address the health and economic disparities that they face in America. This is the catalyst for passing policies that value the needs of mothers of color in America. Our vision is that mamas of color will be a dominant voice in policymaking and politics in the U.S. by changing the conversation around what really matters in the USA to mamas of colors, and that we will lead an independent political system that gives decision-making power to our families of color. We base this work off our Mama's Agenda, which includes paid family leave, basic needs, affordable childcare, and Black maternal health and reproductive justice. And these were created for us, by us. I would like to highlight that our on-the-ground efforts here in Michigan have successfully contributed to the Medicaid doula reimbursement policy that is now active as of January 1st, 2023. We are very excited to share that we have formed a beautiful collaboration with our sister organization and kindred partner, Birth Detroit, named the State of Birth Justice. With the support of Sister Song and Elephant Circle, we have compiled a package of bills that will be our Michigan Mountain Bus. We truly believe that in order to serve the people, you have to ask the people. So we let them share their own stories in their own words with no filters. And we ask our families and communities of color what they wanted, and we moved with just that, the voices of the community. Birth justice advocates from around the state are working to address systemic racism in our maternal health system, and by increasing access to midwifery care and to human rights-centered perinatal care. Legislative barriers to care are limiting the reach of its crucial work. Licensing birth centers and reimbursing midwives' care across the birth settings is a paramount to improving maternal health in Michigan. Comprehensive statewide bills centering community needs and desires, reducing barriers to midwifery care, and honoring and affirming the human rights and dignity of all birthing people will help improve maternal health care and equity in the lives of Michigan families. This bill will include the expansion of coverage for birth center licensure. Community birth centers are, especially Black-led ones, are important to indigenous folk and people of color, and they provide a safe, culturally relevant care to meet the needs of communities of colors facing high maternal and infant mortality rates and perinatal clinic and hospital closures nationwide. Community birth centers like Birth Detroit are designed to honor cultural and spiritual traditions, reflect stories and dreams, and heal the frustrations and traumas of people and families who are not usually centered in the center design healthcare spaces. These bills will also include reimbursement of CNMs and CPMs, integrated perinatal health systems transfer guidelines, data systems and equity, obstetric racism, civil and human rights in the perinatal health period, human rights, the red flag law around domestic violence, the Human Right to Water Act, and the standards of care for incarcerated people. Lastly, we have taken our Mama's Agenda International. We have started the first of its kind, a Black Mama-led Mama's Caucus in DC. With the U.S. State Rep, Rashida Tlaib as our chair, we are excited and hopeful for a true shift in our work. And now I will pass it on to Representative Park Cannon.
Hey, everyone. Listen, Georgia is so grateful for the work that other states like Michigan is doing, because as proud folks related to Sister Song, the Morehouse School of Medicine, the CDC, Center for Black Women's Wellness, Feminist Women's Health Center, Healthy Mothers, Healthy Babies, Sister Love, Hands Free and Happy, the Atlanta Doula Collective, for Kira, for moms, we are here to say it is time to invest in our Black-led and Black-centered organizations. We're excited that there has been state funding to increase access to actual cash for pregnant people by an extension of the TANF program. And we're excited that they finally have listened and have expanded Medicaid postpartum up to 1 year in Georgia. But there's a lot more that needs to be done. The frameworks that these organizations I listed work under, they're nationally spanning collectives that are focusing on how do we put it back in the center, that community midwives should have a day, that doulas should be reimbursed by Medicaid, that we should have telehealth programs that make sure that people's health statistics are safely stored and able to be accessed. Now, we're just on our second annual Perinatal Provider Appreciation Day in Georgia, an event that we started last year to bring together some of the heroes and sheroes of the perinatal movement to the state capitol. And they this year were more clear than ever. They said, support birthing people's multidimensional decision-making and make sure that those who are advising them on the next steps understand birthing people's cultures, histories, and traditions. I'm proud to be a state legislator, but even more excited to be a doula. Wishing you all a beautiful Black Maternal Health Week from Atlanta, Georgia. Let's keep going and let's keep the fight.
Thank you so much to Chanel Bennett-Reed and Rep. Park Cannon, as well as to all of our amazing speakers today. For the audience, are you ready to advance Black maternal health through policy change, but don't know where to start exactly? Here's one thing you can do. Contact your legislators. Click on the link in the chat and sample email language and contact information for your state, local, and federal legislators so that you can tell them that Black mamas matter in policy and practice. To read the full policy agenda we've been discussing today, please be sure to visit our website at blackmamasmatter.org/policy-agenda. We encourage you to not only read it, but also share it widely across your networks.
We want to thank our amazing speakers and all of our representatives for showing up today. And thank you for joining our virtual rally. You can continue the conversation on social media using the hashtag BMHW23 and follow our social media accounts where we are showcasing different events from organizations participating across the nation and even across the globe in Black Maternal Health Week. Also, visit blackmamasmatter.org/BMHW to see a full list of amazing activities happening throughout this week. Continue to join us, and thank you, and happy Black Maternal Health Week.